Hey guys, welcome back to Panhandle Pulse. We got a great guest in Sam Morhaim. He's a software engineer, entrepreneur, and a startup advisor focusing in the healthcare industry. Sam, welcome to the show today.
Thank you. Thank you so much for having me.
Good. I'm excited to hear your background. My family and my sisters and moms all grew up in the healthcare industry and were nurses. So before we dive into some of those topics, tell us about your story. I've seen you moved around a lot before you got here to the state of Florida.
Yeah. So Florida has been in my family's life since I was born. So my aunt used to live here, but I was born in Colombia, in South America, where I grew up. Then I moved a little bit to Israel to study, and then when the dot-com bubble burst, I was in Colombia. I didn't feel like staying there, and I moved to Miami because my aunt was here, my friends were here. So I've been in Miami since 2000, and this is the place I call home. I love it. I think this is one of the most amazing cities in the world. And I've been all throughout the United States. I've been all through Europe. And I think Miami, it's an extremely unique place to be. So that's how I end up here.
No, good. So being at all the places studying abroad and that you felt drawn to the Miami and the U.S. area?
Yeah. Well, the part of the family was here. Also, proximity. Every summer we used to spend here. Even living in Colombia, we would spend our summers, a couple of the winters as well. And so I feel pretty much at home. So as soon as I had the opportunity to move here, it was like a no brainer, and that's where my whole professional journey started as well.
Yeah, that's good. And so you studied abroad a little bit, you said there. How was that experience?
It was probably the best 2 years of my life. I was young, right out of high school, and I moved and basically we do cohorts. So with all people from all around South America and Europe and everywhere around the world. Sometimes they move to Israel to study or to live. And so my cohort was about 150 people from Argentina and Uruguay and different countries. We were about 5 or 7 people from Colombia that I grew up with. So we were all friends. And it was an amazing experience just getting to first of all, live by myself. I know for some Americans that might be, the normal thing to do when you're right out of high school. But for most traditional Latin American families, that's not the norm. Typically, you stay until you graduate from college or you get married. So for me, it was a unique experience having to, go there, learn a new language, be exposed to so many other cultures. It was an amazing experience for sure.
Good. Now, is that when you started learning to be into tech, the IT and engineering realm, or when did you start getting that bug?
So remember the day exactly. I was probably 6 or 7 years old, and my dad in Colombia, he said, we're going to go buy a computer. And so we drove to this place. This guy had a computer. It was a Commodore 20. And so I don't want to date myself, but it's a really, really old computer. This predates regular PCs. I still have it actually. And we bought it, and it's not like it is today. It's not, for most people, this is going to be very, very strange, but you would plug it to your TV, and instead of USBs or floppies, it used an audio cassette, and it didn't come with anything. Basically, you had to program whatever you wanted to do with the computer. And it had a booklet, and I started reading it. I was 7 years old, and I started reading the instructions: 10, open file; 20, do this. So you had to write the line of the line numbers of the code. And that was my first experience. So I'm a self-taught engineer. When I was in Israel, I actually studied a little bit of international relations. When I moved to the States, I have an associate degree in business law. So I never actually studied engineering, but all my career basically was around IT management, quality assurance, and ultimately software engineering.
Yeah. And that transitioned and focused into what you're doing today. How did you want to go out and create your own business, and specifically in the healthcare industry?
Correct. Yeah. So when I moved here, I worked a little bit in a .com company, probably the few remaining ones after the burst. And then I worked in basically a fashion wholesale company for 5 years, managing the IT department. So I was building the infrastructure, the terminals, managing support. And one day, this guy comes to me and he says, "Listen, my cousin has a big company about developing electronic medical records." And so for me, that was completely new. I didn't know there was such an industry. And he said, "He's hiring. You should go there." And it took me almost a year to make the decision. Basically, build the courage because I was so comfortable where I was, and I end up going there. They interview me for a quality assurance position in this software development company, and I just felt. First of all, I felt at home going from like fashion, where technology is an expense versus an investment, and going to a purely software development company and working with healthcare and patients and doctors. And so I fell in love with that industry. And since then, that was probably around 2006, 2007 when I made that switch. And since then, I've mostly been in healthcare.
Good. And how has that changed over the time that you've seen healthcare now with everything been in our health records on our phones versus the old reports where we had to keep track of everything, our mobile wear and devices? How did you see that's changed over the time you've been involved in it, and where do you see it going?
Yeah. So, I mean, it's day and night. There are two sides of it. So one, especially for us here in Florida and the States, our healthcare system remains broken. Navigating it, all the things that happen are terrible for everyone. On the other side of the spectrum, there we have so much technology and advancement and hyper niche of the doctors. We have we have those specialties that no other country in the world has, and so much advancement that all the other countries of the world come here to be seen by doctors. Unfortunately, then they face the bureaucracy and the red tape surrounding it. But it's just those two spectrums are just something to think about. On the positive side of the spectrum, yes, the technology it's amazing. Like being able to going from having to carry your chart around or having to fax papers left and right, and now being in a position where basically your records are ubiquitous. Every doctor that needs to see you can access your records. There's been so much advancement at the policy level and at the technology level, because even the Florida Health Information Exchange was created to facilitate this exchange of information. So the government has been doing its part, but on the technology side is just advancing so rapidly that it's mind blowing. And the last 3 years, of course, are with AI are even much faster than before.
Yeah, and that's a great point. I work in tech as well. So coming from that background, right now there's so many different systems that we have within our doctor's offices or hospitals. How difficult is that to integrate and make it where our data is safe, secure, and also easily accessible for us?
Yeah, and that is precisely, I think, one of the main technology challenges that we still have is that interconnectivity between systems. Because when you go to, if you're on a practice or you go to you have 4 or 5 different systems. They don't talk to each other. And if they talk to each other, it's a mess. There's duplication, there's errors, there's all these things that need to be considered. And we're still not there. And I think that the following 12, 24 months are just going to make a big leap forward in terms of interoperability, because all the systems, everybody's talking about MCPs and, a faster access to APIs to be able to connect the systems. And even probably at a higher level, what I'm seeing is people are rebuilding their own systems, because now everybody's a developer, right? So anybody can come up with an idea and say, I like this and this and that from those different systems, and I just want to build my own custom system for my own practice or for my own clinic, and they can leave some of those interoperability issues behind. So that's the biggest challenge that I see so far, and one that's probably going to be fixed within the next few months.
Yeah, and with that, that's a great point for open API calls and access to different areas. Like now, all of us today, speaking of in listeners' terms and technology terms, is we have Google Drive and Apple Dropbox and iCloud and all that. Do you ever see a point where you will be able to have all of your information just centrally located for the individual or the patient to be able to have access to transform that across to every doctor they visit?
Yeah, I think that's key for AI in general, and for business, and especially for healthcare, to have all your information in a very secure and safe way to access it and store it. Because think about it, the most important thing when you use ChatGPT or use any of your AI tools is the context. That's what makes or breaks a good experience with AI, is that whole narrative that ChatGPT has about my life, because I've been using it for 3 years. It has so much context And now it's reading my emails and it's reading my bank accounts and it's reading all these things. And the more I give it, the more it can give me back. So especially with healthcare, being able at some point where I am able to just say, connect the dots of my healthcare situation, that's going to be a game changer. Of course, the the two biggest hurdles right now is interoperability, where all this data lives and how can communicate to the other systems, and security, which is what probably, I don't want to say drags it down, but actually slows everything down because you have to be very careful about security. The last thing you want is, one of these AIs to go rogue on you and share all this information openly without your acknowledgement.
Yeah, I agree. So how do you help hospitals and clients deal with that and transform that in the future?
Yeah, so that's probably the biggest thing of how my own business has been transformed in the last 3 years. We started basically building software for other healthcare companies. So if an entrepreneur, if a founder or a team had an idea that they wanted to build this application to track some health metrics, or they wanted to make an application to help doctors do something easier, they would hire us, we would develop it, it would take a few months, and then we would launch. However, all that now is compressed into a few hours, right? If you're talented enough, in a few hours, a couple of days, you can develop all of that. What has changed dramatically is having the taste of what to build and what not to build, because the AI will build anything that you give it to, that you ask it to build. But knowing what not to build now becomes a skill. And most importantly, all the security aspects, there are a lot of compliance and governance that a normal healthcare company or health tech company needs to have. The security, how do you store the data? How you transfer it? What mechanisms you use? The AI has an idea, but you need to drive it in the right direction. Otherwise, it makes for it looks very beautiful, it works, but it's very sloppy under the hood, and that can basically expose you to lawsuits and a lot of different issues that you don't want to be involved. So that's pretty much what we do right now. Is we help these founders and teams build the right thing, build it compliant, build it secure, build it to scale. Again, AI will build your application. As soon as you have 5 users, it's going to break down. It's going to get better, but unless you know what you're doing, you won't be able to just put it on a server and start serving doctors or patients because you don't have all those additional layers.
Yeah, great. It's a good starting point for there. Some good advice for startups. How do you get them to go in front of these practices or hospitals to get them to look at a new set of tools, since they've been utilizing their products and their systems for years and are a little bit lenient to change?
Well, so everyone is understanding that first of all, technology is moving much faster than it used to. So big hospitals and enterprise are looking at AI, not so much at AI as we see it, ChatGPT and everything else. They see AI as a transformation force. So they're used to doing things one way, and now they can basically expedite and accelerate their transformation to serving their patients better, or serving the doctors better. So they're very much open to it. They're very hesitant of the effectiveness. And so one of the most important things is being able to have a proper demo, a proper pilot, a proper MVP, and most importantly, that you can measure the output so that you can say, okay, when we put this on this practice, we can measure the ROI. So and not necessarily in terms of financials, but is the doctor making better decisions? Are the patients having better outcomes? So if you're able to show that very explicitly, and it's also safe, that it can, you can trace all the answers, you can make sure that your system is HIPAA compliant, then you have a much better chance to be seen by an enterprise, by a hospital, than you used 5 or 10 years ago. Because then basically you had to build all that up front, spend millions of dollars so that they would even consider you. Nowadays, they're open to it with that caveat that they're hesitant and they want to make sure that you're actually delivering value and everything's safe.
Yeah. And so with that advice, would you suggest new companies getting into this space to start off with the prototypes and do some small pitches before they go out and build or raise capital? What would be some of your advice on how to get started?
Yeah. So I've seen companies worked with either bootstrapped or raising capital. I think the most important thing is now that you don't necessarily need capital nowadays to build the product. That used to be the big obstacle 3 years ago. You needed an engineer to be able to build that for you. Now what you need is a team or a consultant that can actually guide you into how to build it, make sure that it's secure and compliant. You don't need 6 months of runway or 12 months. Now you just need a couple months of runway. So anybody wanting to start, you can do it bootstrap. You don't need to wait for raising capital. Now to raise capital, and I learned this from the Lean Startup book. I forgot the author, but it doesn't matter if you have $1 billion in sales or $1 in sales. What investors want to see is that you had one and now you have two. They want to see progress. They don't care if it's $1 or 1 billion, as long as you're getting progress, making progress with your product, making progress with your audience. That's what they want to see. And so if you're able to say, even if you don't have any clients, if you have one interested clinic and now you can have two interested clinics, you're going to be able to raise capital. But in order to do that, you need to have the product built, which is no longer an obstacle. And you need to make sure that it's compliant, safe, scalable, so that when you get your first 2-3 clients, it's not going to just shut down on you. So those would be the key areas: being able to have something built, that it works, and that it's going to grow and be safe.
Yeah, that's great advice. And you hit on one thing earlier where you talked about making sure you're building something that's usable and valuable. How do you work with the customers or your startup clients to find that one program or that one thing that would be valuable out of the gate to start off with?
Yeah. So we use a method called data-driven development. And before we build the first feature or we write the first line of code, we help the founders. We work side by side with founders or small teams to just be able to clarify the idea. Founders typically like to add all these things, bloating up their MVP, and they just lose track of what is it that got them passionate about building. And so we try to narrow it down. Then once we have enough evidence and enough clarity, we look for evidence so that we can justify building that single feature, knowing that there's a market, knowing that technology is there, knowing that security and governance and compliance, you're going to be able to not break any rules. And once we have all of that written down and clarified, then we go and build. And we build in iterations. So there's a specific framework that we follow to make sure that we're building what's going to move the needle, not just what's going to look nice, but actually things that are going to move the needle, be it for your doctor or the patient or the business as a whole, being able to track those things. So we also encourage our users tremendously to add analytics from day one. If you're building directly with Cloud Code, that probably it's an afterthought. When we start building, we do that from day one. We want to make sure that we measure how the users are using our system and the outcomes, right? Whatever that outcome is, we need to track it and keep an eye on it. So that's basically, that's in a nutshell how we go from 0 to 1. We go from that idea to something that you can sell in a matter of weeks with the people that we work with.
Yeah, and that's good advice. And when you're building those out, going through that program, where do you see the value in the future? Because for us as everyday sort of consumers or insurers of health insurance, we want the cost to go down. We want it to be lower every time that we go and see the doctor. Same for the insurance business as well as the doctor's visits as well. Do you think in the future companies can help save cost for hospitals and insurance companies to reduce that? Or is it just going to continue to go up as it is?
Unfortunately, that's where I open with a little bit of pessimistic outlook. I think that the incentive, it's not there for costs to go down at this point. It doesn't matter what technology does, the incentives by the payers, from Medicare all the way down to your individual insurance, the incentives are not there for costs to go down. They rather spend millions of dollars on bureaucracy and rejections and pre-approvals rather than going at the core of what's causing the issue with the patient. There's a hint of light there's a program called MAHA Elevate Initiative, where they're actually piloting. This just came out 2 or 3 months ago. They're giving money to. I think they released $50 million for companies looking to do evidence-based, root-based medicine for chronic conditions. So they're looking at least at the holistic aspect of a condition, of a chronic condition. It's not just about giving you a pill to lower your insulin, to lower your glucose. It's actually looking at how to help you mentally, physically, with supplements, with all different aspects to lower your glucose so that you can improve your condition. And so the federal government is trying that. That may at least starting to incentivize. I think it's supposed to launch by 2030, where there are going to be some incentives in getting better outcomes rather than just doing another procedure, another billing code. So that may be coming our way, but it's still, a few years away.
I believe that sort of goes back to the whole holistic view of your overall health. If you can utilize those apps like the Calm app or other apps that we have on our phone with the technology and the information ourselves, it will improve the quality of life for all citizens.
Yeah, exactly. I think these apps, they're tremendous help. I mean, it just takes some time for people to get to know them, get to trust them. No, especially with any, there's a saying in marketing, when you either sell a painkiller or you sell a vitamin, and which one sells faster? Of course, it's the painkiller, because you take it 20 minutes later, you feel the effect. But vitamins take much longer to get into your body and be bioavailability and absorption and etc. With this type of applications or these type of approaches, which are holistic, they're not immediate, which is where we lose 80 or 90% of the people, but they do work when you're doing consistently, right? So when you're able to start tracking, giving some initial feedback to the user, I do a lot of meditation. And when I can gamify my meditation habits, I've been able to be more consistent, because I can see immediately it's showing that my HRV is it's optimal. My sleep performance is getting better when I don't do it, and then I overeat or don't exercise or do whatever, those things. I see the changes and I can track them. So all these applications that are giving us instant feedback are just going to get better and better. We've seen the continuous glucose monitors; those are amazing. Because now you can eat that candy bar and see how bad it made you feel, and see the numbers. And so you get that immediate feedback. So I think that's just going to get better and better.
Yeah, and that's key. That's a huge thing that we've got now, is those glucose monitors that instantly gives you that feedback in there. I think one of the things people are worried about is with the apps and all the information is the security component that you talked about. But how do we convince the industry as well as ourselves that we're going to continue to balance innovation and safety and security going forward, but utilize it for the best and at the speed that we need it?
Well, so I think, as I said, I think AI for building technology products is just going to get better and better. People are going to be focusing less on the nuances of building software and focusing more on the end product. And as a byproduct, they're going to be also focusing more and in an easier way into security, compliance, and governance. We just released last week an open source package for engineers or anybody using Cloud Code or Codex, any of those terminals, to actually put in HIPAA compliance into their development workflows, so that when you're writing and you're asking Cloud Code to build something, it knows that it needs to follow certain patterns and certain guidelines to be compliant. So from day one, you're no longer building blindly. You're actually following a playbook that gets your application to be safe and give that confidence to the end user. So things like this package that we released called ClearMap, those type of things are going to become more ubiquitous as we go along, and they're going to just become part more and more of this tool. So building compliance software is going to get easier and easier. I think at the bottom of all of this is going to be that concept of having taste, knowing exactly what to build, because that's just going to make a difference. I just downloaded an application today, which is a replica of another application, and the onboarding experience was terrible, because it accomplishes the same objective, but they didn't spend so much time into that onboarding process. So all these applications, you're going to be able to focus more on that end user experience, adoption, compliance, rather than just focusing on the underlying issues. And we're going to see a lot of magnificent applications being built.
Yeah, that's good. Yeah, onboarding is a key component on there. User friendliness and easeability to do that is definitely on there. So with that, with the onboarding part of it, what are some of the areas that you're paying attention to right now in the healthcare and tech world that everyone else should be looking at?
Well, there's a big blind spot on all this type of tools, which is accessibility. And so there's a big group of the population that are probably either visually impaired or hearing impaired, and all these applications are going in a certain direction where now you need to read much more, you need to write much more than before you just move the mouse, click click click. all these applications are turning into a certain type of use that might be not appropriate for certain populations. So accessibility is one area that we look into a lot. When we build an application, we make sure that it's WCAG compliant. We make sure that it's accessible. If somebody with low vision can't use it or it's not easy enough, it's not going to be friendly enough for the rest of the population. So we focus a lot into that. I have a personal reason for it. Some of my family have visual impairment. And so I know how frustrating it is for them to go to the doctor and having to be asked to fill in those 30 pages with very small print on their conditions for the 20th time. So
Right.
those are things that are at the core things that people are not paying attention enough. So for onboarding and usability, that's one thing that people should pay more attention to.
Yeah, and that's good. Yeah, I didn't even think about that part where we have everything today in tech with you need to help the visually impaired, the deaf, and other restrictive users getting access to the information.
Yeah. Yeah. And on the other side, there's a lot of tools coming out. So, you can do a lot of text to speech and speech to text, which is helping, right? But they're not just ubiquitous. They're not in all platforms, especially not in healthcare, because then it's another risk surface that you need to consider. It's another business associate agreement. So when a platform is building, maybe the last thing they consider is let's add another voice assistant because again, it's an extra compliance and extra integration, and they're not considering that, but it helps. And there's like this example, there's dozens that will help people. Again, might not be your 90 or your 80% of the population, but that 20% that will need it will love your application, will be very grateful if they can use those applications if you think about them when building them.
Yeah, and that's another area that you could help advise on and focus on before you even started building the application out the gate is to focus on areas that are not heavily targeted right now.
Yeah, exactly. And we talk about, when I talk to founders, when we're doing consulting one-on-one with them, we talk about the moat of your application and what is that moat. And most of the founders will go and start talking about their features and all these things that it can do. But that's not really the moat. The moat should be the data that you're building, all the things that your application is quietly storing behind when it's being used. That is data that you can be collecting, that you can be using to improve your own platform and later on to make additional new products. The other thing is, of course, testing. So again, your moat should be, I have my own proprietary data. I create my own data. I tested my data and I tested the outcomes that I'm building, because that's what's going to be a huge differentiator between you and somebody that just opened up Cloud Code and built an app, is going to be able to say, I already went through this. I thought about compliance, security. I thought about testing, reliability of the application. And I thought about all the other things that the app can do, not just for the user, but for the company as a whole, right? Being able to build on that data and use it to improve the experience of the users. It's at the core of what I consider should be your moat, not just a feature, because today we can all build a feature in a couple hours.
Right. And so part of your startup consulting services that you do, if somebody wanted to reach out to you, how would they get in contact with you? And what is some of the advice that you would have to offer on one of your consulting calls or your initial calls?
Yeah. So if you're a founder or you're a team building a new product, or you have an idea and you want to go from 0 to 1, we basically offer 2 tracks. One is if you're in that initial category 0 to 1, you can book a 30-minute call with myself or somebody in my team to help you clarify that idea, see the areas that maybe those blind spots that you're not looking at, the compliance, governance, security, and help you make a better decision. You can just go over to VantageIO.com/book and you can book a call with me. If on the other hand, you already built something and maybe you're losing sleep because you're not sure if you're compliant enough, or you're about to sign that enterprise deal and that security questionnaire is going to come your way, you can have, we can do a security audit for you. You can also go to VantageIO.com/book. It's a 30-minute free audit call. We'll go over certain areas of your application. And if it makes sense, we can then help you either remediate those or give you that sense of security confidence that everything's working the way you expect it to be.
Good. And roughly how many of those do you guys book and take on at a time from a consulting point?
Very good question. We take very few people at a time. Most of the consulting I do myself. I have other people in my team, but so I limit myself to about 5 to 6 clients per month. Make sure that we give everyone their fair amount of time and value. And then we have a team of engineers that are all AI enabled, and they can all go help and remediate issues or build the next wave of features for your application. So we're very selective. We also make sure that you're aligned with what we're building or where we can help you. If you're building a game, that's not going to be something that we can help you with. But if you're building in healthcare, you're thinking about patients' outcomes, you're thinking about efficiency in healthcare, that's something where we can definitely help.
Yeah, that's great. And what do you think one of the biggest mistakes or missteps or the founders make out the gate when creating something specifically for healthcare?
I think the biggest mistake is thinking that just because your total addressable market is big enough, that you're going to get the attention of all of them. So you hear all this all the time, right? So there's 50 million patients with this, so I'm going to be able to sell. And they go for what seems to be a conservative number. They're like, if I can get a tenth of those, 100th of those. So when you're doing those numbers, you're underestimating the difficulty that it is to reach them. So people focus a lot on the product and they say, I have 50 million, I can get a 1% of them, I can get 5% of them. Even getting to a fraction of a percent of a market takes a lot of creativity and effort. And so again, anybody can build a product. It just takes a lot of skill and trial and error and experimentation to be able to figure out how to talk to them so that they'll feel that you understand their pain point and they'll be willing to at least open their ears and eyes, let alone their wallets. So that's probably the mistake number one that I see from all founders that we worked with, is having that unrealistic expectation of how big their market is and how much of that they can absorb.
Yeah, that's good. And I'm sure you can help them with making a pivotal point and changing where they are now if you see the industry a little bit different versus where they're trying to target today.
Exactly. Yeah. The industry is shifting every few days. Before it would be every couple of years. Now everything's shifting so rapidly that by the time you finish thinking about a product, somebody's already building it halfway around the world. So that's no longer a differentiator. The
Right.
differentiator has to do with your go to market strategy, with your platform. That's huge. You see all the VCs now recently starting to feature it. They're not investing so much in companies. They're investing in platforms. So there's an influencer and it has 100 million people following them. They invest in that because they know they can sell any product to that audience rather than just build a product and then having to build a platform. They're going the other way around. I think that's key. And being able to spot those trends and be clear about who you're serving, what is the problem that you're trying to fix, and being aware of everything that's going around you. That's where we bring a lot of the value, and we help them navigate and, as you say, pivot on the spot because there's no time.
Right. And so what do you hope happens over the next with the advancement of AI every day now and the engines just continue to get faster and faster that at some point it'll come to full scale. We'll have a little bit of a slowdown period, but what do you see and hope the industry happens in the next 5-10 years from a healthcare perspective?
Wow. So even a year probably it's going to be too long to forecast. But I do think that information, your context is going to become ubiquitous. I think security is going to get much better in a way that anybody can have access to the context so that they can do better care for you. I think that in the models layer, all of them are going to become as good as the others. And I mean that for all LLMs. Just talking about large language model, but all of them are going to get to the same kind of threshold of knowledge. What's going to make the difference is how you put them to use and how much context they have. Because OpenAI and Anthropic and all the open source models, they're going to get to a point they're going to be equally as good. So what's going to make difference is your access to the data and the uses that you can come up with, how you orchestrate different models, how you orchestrate the retrieval of data, and make that very useful in a very elegant way to basically fix the problem that you're trying to fix. And I think all this, there's a lot of models in terms of like scanning the back of your retina to do early detection of Alzheimer's and other diseases. When that information, when you went to the ophthalmologist and they have that piece of data, and then you connect it to your lab work, and you connect it to another 100 different biomarkers that they're going to be able to extract and map to a condition. You're going to get a lot of early detection, early therapies, and that's only on the therapy side. Forget about all the manufacturing of peptides and other medications that are just accelerating. I'm not that much into that, but I see the advancements just like, every few weeks we're hearing like they double up and triple up what they used to do in the last 20 years. So I think the future is very, very bright for healthcare in general. We can get over the hurdle of bureaucracy and red tape.
Yeah.
I think we're going to be in a really good place.
Yeah, you hit the key point. If we can get over the bureaucracy and red tape of the healthcare systems, the insurance providers, and the government, we would be light years
Yeah.
ahead of where we are today.
Yeah. Yeah. I was going to ask you, where do you see that as you're also involved in this industry? Like, what do you think is going to be the one thing the government can do to alleviate this issue?
Yeah, I mean, that's a great question. I think the process of sort of like some of the European countries and other countries are doing are allow us to have access to our information and be able to share it as we see fit without providing all these release forms. So HIPAA forms or who can have access to my information. Right now, if you transfer from one doctor to the next, you got to fill out a bunch of paperwork to send your information over. If it was sort of like other countries, they allow you to transfer your data wherever you are. You essentially own your data. It's your data. If we can get to that level and be able to take our data where we want between doctors and share the information, I think that'll take a big part of the bureaucracy away. But that has to come from our government to allow us to do that. Instead of worrying about the safety rules of what health information we're going to release, make it more readily available to ourselves. That will then help, again, startups be able to produce information, open AIs, and doctors provide.
Yeah. Yeah. You're spot on. And I think that goes with what I said, building applications that are safer. It's just going to become more and more easy to do. And you're going to be able to focus it's on the end user, not so much on the code and the compliance, because that's going to be at some point, hopefully the government will realize that they're just getting in the way, that all this privacy, yes, it's needed. You need to protect the data. But when you do it to a degree that it just becomes a burden, all the billions of dollars that we spend in only protecting the data, it can go into developing new therapies or treating people, and it's just going to be a much better place to be in.
Right. Yeah, I mean, that's exactly right. Protect the data, but use open APIs, access calls for us to collect our data. And then as you sign up for Disney or your Netflix, you're signing a waiver, releasing your rights. You would have the same thing in an app for your healthcare. You would release your right if you wanted to share that information with your doctor or so on and so forth, which if we get to that point, the healthcare would be just, in my point of view, a whole lot better. Instead of the doctor guessing what happened to your blood work a year and a half ago, or you have a new doctor and they got to go back and relive everything that's happened to you in the last 47 years. If it was readily there and AI can summarize that information for the doctor in 5 minutes, he can read a summary of your healthcare before he comes to visit you. Like how much?
Yeah. It just, again, I think it's going to go hand by hand. It has to be done securely so that, like most of us probably, we don't care if it becomes publicly known that, you have X condition or Y condition. It is a sensitive topic for some people. So we want to make sure that stays safe, that, there's a lot of malicious actors that would abuse of that information in different many ways. And so this reminds me, last week we used this tool, again, the one that we released, and we analyzed 25 different open source projects in healthcare. I'm not going to name the names because we just submitted the PR packages. Basically, we found vulnerabilities in all of those packages. So we found vulnerabilities, HIPAA violations. There's all these things that we identified in those software products that people are using today, doctors and clinics and hospitals. We find all these vulnerabilities. We are submitting tickets to help to get them remediated. But you realize basically these are projects that have been used by thousands of users for years. And we're, of course, at this day and age, we're still finding issues. And so anybody can go and exploit them. I think the mission should be to make sure that we're safe and reliable so that it doesn't happen to anybody, but at the same time that it doesn't slow down innovation, that a practice is going to be so hindered by all these things that they need to think about, that they don't go and make the change and make it better for the patients. So I think that balancing game is just going to get hopefully easier in the next few months and years.
Yeah, I agree. I hope so as well too.
Yeah.
Well, Sam, it's been great having you on the show today. How can people find you? Where can they connect with you on the internet?
Sure. Yeah. So I'm on Instagram as Morhaim, or you can go to vantageio.com/book. You can book a 30-minute call with me. If you're building from 0 to 1, you have an idea and you want to make it into production quickly and safely, we can help you with that. Or if you already built, you're about to close that enterprise deal, you want to have a security audit, you want some help with your roadmap, we can also help you there. 30 minutes free, no agenda, no pitch. We just want to have a conversation. And if we can help you, we'll love to. So vantageio.com/book.
Perfect. I'll post all those in the links too, so everyone can see that in the episodes and shows.
Thank you. Yeah, no, it's been a pleasure. Thank you so much.